Now, can I come in?
Yes.
Hi, my name is Geneviève. I'm a nursing student at Montgomery College. I'm going to be doing your bedside assignment today. Is it okay?
Okay.
Okay, I'll go ahead, provide some privacy and gather all my equipment that I need here and then wash my hand, okay?
Okay.
So, my patient, are you comfortable? Yes, my patient is in a good posture. My patient fine. The dressing is fine according to the weather out there is appropriate. And then I'm going to go ahead and ask some questions, okay?
Okay.
So, can you tell me your name?
My name is Sarah.
Okay. Can you tell me today date?
Today is just the December 1st, 2020.
Okay. Do you know where you are?
At the hospital.
Okay. Can you tell me what brought you here today?
I'm probably running fever again. I have been coughing with yellow sputum for 3 days, and I took Motrin for fever 6 hours ago. My cough is getting worse and worse recently. I am short of breath when I walk.
Okay. The patient is alert and oriented time 4. She could answer 4 of the questions that I asked. Now, I'm going to go ahead and do you have any pain?
No.
No pain. Okay. How about, are you allergic to something?
Aspirin. Penicillin.
Penicillin. Good. So, I'm going to go ahead and take your vital sign, okay? I'll start with the blood pressure. Okay, your blood pressure is 112/62. And then I'm going to take your oxygen, okay?
Okay.
The oxygen is 93%, okay?
Okay.
And your temperature is 100.2 Fahrenheit, okay? So, do you have any problem with your sleep?
No.
No problem with your sleep. Are you anxious?
No.
Do you experiencing any stress?
No.
No stress. You don't have any stress, okay? So what is your support? What do you have as a support?
My husband.
Your husband is your support, okay? Good. Now I'm going to go ahead and start with the assessment by itself, okay?
Okay.
So I'm going to start with the head, okay? Do you have any headache?
No.
Any dizziness?
No.
Okay. I'm just going to go ahead now and inspect, okay? I'm inspecting for the hair configuration. Your hair is in a good shape, and your hair is symmetric, and your scalp is fine. I didn't see any sign of like mass on your head, okay?
Okay.
So which is fine. So now I'm gonna go ahead and access and do your eyes, okay?
Okay.
So do you have any problem with your vision recently?
No.
No problem. Do you wear glasses?
No.
No glasses. I'm going to inspect, okay?
Okay.
So I'm inspecting for the alignment. I'm inspecting for the symmetric. I'm inspecting for the sclera. The sclera, your head is symmetric, your head is aligned, your eyes is symmetric, your eyes is aligned, your eyes is symmetric, is aligned, your your eyelashes are full, your eyebrow are full, the sclera is white, which is a normal color. Then Now I'm going to access the cranial nerve, okay? I'm going to access cranial nerve 3 and 6, okay? So the cranial nerve 3 will be just for you to read or to show me if you can see it. Can you close your one eyes and tell me what is this?
Again.
Close the other one and open this. What is this?
Again.
Okay, I'm going for the movement, okay? For your eyes. I want to see if your eyes move symmetrically. Okay, your eyes move very good symmetrically, and then I'm going to go to check your pupil, how they react to the light, okay?
Okay.
Okay, your pupil are equal round and react to the light and accommodation, okay?
Okay.
Now, I'm done with your eyes. I'm going to go to the ear, okay? Do you have any problem hearing?
No.
No problem with your ear. Okay, do you have any pain there?
No.
Okay, I'm going to now inspect your gross ear, okay? Just tell me, can you hear me?
Yes.
Can you hear me here?
Yes.
Okay, good. Now I'm going to go to your mouth, okay? So, do you have any problem with the food eating?
No.
No pain?
No pain.
Okay, now I'm going to inspect, okay? Your lips are pink and moist, no sign of dehydration. Now, can you open your mouth for me? Your tongue and moist, there's no sign of dehydration there, good. And now your teeth are intact. Your teeth are intact. Okay, now your buccal mucosa is pink and moist, no sign of dehydration. Your gum are intact, there's no bleeding sign, which is very good. Now I'm going to access the two cranial nerve, okay? Cranial nerve 10 and 12, okay? So can you swallow? Do you have any difficulty? Good, good. Can you move your tongue side to side for me? Good job, good. Now I'm going to go to your neck, okay? So let me see your neck. Okay, I'm gonna inspect, okay? I'm expecting to see your neck is symmetric. The skin on your neck is well distributed. The trachea is in the middle. There's no visible mass. And then I'm going to access the cranial nerve 11, which is the strength you have when you strengthen your shoulder, okay?
Okay.
Can you, against me, can you do this so I can see? Good. That's okay, go ahead. Again. Good. And then I'm going to access the cranial nerve 11, which is fine for your neck. Then I'm going to access the cervical spinal. Can you bend for me? Okay, good. Can you bend? Okay, good. I'm done with the neck. Now I'm going to go to the thorax, okay? Do you have any difficulty breathing?
No.
No difficulty breathing. Any cough?
No.
Any sputum?
No.
No cough, no sputum. Okay, I'm going to inspect, okay? I'm expecting to see a skin characteristic, the symmetric, the epidiameter is fine 2:1. The skin is well distributed. The is symmetric. Your chest is symmetric because I'm expecting to see the chest wall, the symmetric of the chest wall, and also the work of breathing. Okay, the work of breathing is not too bad. You are not really breathing with like a lot of difficulties, just a little bit, okay? So now I'm going to go ahead and auscultate, okay?
Okay.
I'm auscultating to hear for the loud sound. I'm going to start with the anterior one, okay?
Okay.
I'm going to ask you to make a deep breath. Like every time I put it, you take a deep breath. Take a deep breath for me. Good. Take a deep breath for me. 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 Last deep breath for me. Good. Now I'm going to go to the posterior one, okay?
Okay.
And I want you to come here. Okay. No, don't take a deep breath, okay?
Okay.
Take a deep breath for me. Take a deep breath for me. 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 Okay. I didn't hear any crackle on your legs, any wheezing, okay? Now, I'm going to go ahead and do your heart, okay? Do you have any chest pain?
No.
Any palpitation?
No.
No palpitation. So I'm going to go ahead and auscultate, okay? So I'm auscultate for the S1 and S2 sound, or the heart sound, okay?
Okay.
I'm going to start here. I'm listening for the valve, okay? Yeah. The aortic valve is the second intercostal space. The pulmonic, the second intercostal space. The herpes point, the third intercostal space. The telescopic point, the fourth intercostal space. The mitral is the fifth intercostal space. And then I'm going to listen at the same time the apical pulse for a full 1 minute, okay?
Okay.
The apical pulse is strong and in the normal range, 75, which is in the normal range, okay? Now, I'm going to go ahead and do the abdomen, okay?
Okay.
So, I'm going to be asking you a question again. Do you have any problem, any constipation,
No.
any diarrhea,
No.
vomiting?
No.
How about the nausea? When was your last bowel movement? Today?
Yes. Yes. It's, this morning.
Okay. So now, do you have any problem with your urination?
No.
Do you urinate normally?
Normally.
You don't urinate a lot?
No.
You don't urinate less? You don't have any retention?
No.
No incontinence?
No.
Okay. How about, do you wake up during the night to go to pee?
No.
Do you notice any blood in your urine recently?
No.
Nothing like that? Okay. Now, I'm going to go ahead and inspect, okay?
Okay.
I'm expecting for this hair distribution. The hair distribution, your head is very distributed on your abdomen, and your abdomen is symmetric, and the contour are round. The umbilicus is in the middle. Okay. Now I'm going to go ahead and auscultate, okay? So I want you to lay down for me to auscultate, okay?
Okay.
I'm going to auscultate the 4 quadrant, okay?
Okay.
I'm going to start with lower right quadrant. I'm going to start with the lower right quadrant here. The upper right quadrant. The upper left quadrant. The lower left quadrant. Okay. The bar sound as intact, they are intact, okay? Now, I'm gonna go ahead and they are intact. There is no sound of, I didn't hear any like super active bar sound. They are just intact and fine. Now I'm gonna palpate. Do you have any pain?
No.
Okay, I'm gonna go ahead and palpate. I'm palpating to see if there's any distension. No distension. Any mass? There's no masses. I didn't hear any distension, even guarding. Okay, good. You can sit down now for me. I'm gonna go ahead and do the peripheral, okay?
Okay.
So any numbness,
No.
any tingling,
No.
no numbness, no tingling. Okay. I'm gonna go ahead and then I will inspect, okay?
Okay.
Do you have any numbness? Do you have any tingling on your chin? So I'm gonna go ahead and inspect for the symmetric, everything is fine, the hair distribution, the hair is distributed everywhere. I'm gonna go ahead and do your skin toggle to see there's no sign of dehydration. The skin goes back in the normal in less than 3 seconds. I'm going to do the capillary refill bilaterally, which is good. I didn't see anything bad on that one. Everything is fine. I'm going to look for the edema. Didn't see any edema. And then I'm going to go ahead and do your radial. I'm going to check. I'm going to listen for the pulse, okay? So I'm going to do the radial one, okay? I'm going to do them bilaterally, okay? I'm going to do them for 1 minute. This is a brachial one. And then I'm going to go here and do the radial one here. Then I'm going to do the brachial one. Each one for 1 full minute. Good. Then I'm going to do the posterior tibial one for 1 minute. Good. Then I'm going to do the dorsalis pedis for 1 minute. All pulses are intact and in the normal range, okay, between 60 and 100, which is 78, which is good. Now I'm going to go ahead and do the integumentary, okay?
Okay.
So, do you have any itching?
No.
No irritation?
No.
No irritation. Okay. I'm going to inspect for the temperature on your skin. The skin is warm. Good, it's very warm and moist. And then I'm going to go ahead and inspecting. I didn't see any incision. I didn't see any wound. I didn't see any dressing. Your skin is really intact, which is good. And then I'm going to go ahead and look at the everything is fine for the skin, okay?
Okay.
The hair is well distributed, the temperature is good, it's moist, and there's no incision, no sign of no dressing, no scab, no incision, no wound, which is fine. Now I'm gonna go ahead and do your musculoskeletal, okay? So do you have any problem moving around?
No.
The immobility? No, you move around like you're really good. Any deformity?
No.
I didn't see any deformity. Okay, I'm looking for the deformity here. I'm inspecting for the skin discoloration around the joint. I didn't see any. I'm inspecting for edema. I didn't see any edema. So now I'm going to go ahead and do the range of motion, okay?
Okay.
So we're going to start with the upper, okay? So we're going to do the hand. It's going to do the active. I don't do anything for you. It's the active range of motion with the strength. We're just going to follow when I ask you, okay?
Okay.
So let's start with your hand. Push against. Push. Push. Good. Push against. Good. Your muscle are strong. Okay. So now let's do your hand, okay?
Okay.
So I'm going to do the range of motion, okay? Of your hand. So flexion, extension, flexion, extension. Let's do the whole arm. So we're going to do like this. Flexion, extension. Go ahead.
Flexion.
Extension, upper extension, Yes, how about rotation? In rotation, no, in rotation, in rotation. Okay, now abduction, adduction, abduction, adduction. Okay, now you can, I want you to do your hip, okay?
Okay.
So for your hip, you're going to do, let's go. Abduction, adduction, abduction, adduction. And then you're going to do your legs now, okay? Your legs, raise your legs up for me. And flexion, flexion, extension, flexion, extension. Now abduction, abduction, adduction, abduction, adduction. And good. Everything is fine. You're doing very good, okay?
Thank you.
Okay, that's good. That was a good experience. Now, do you need anything?
No.
Are you comfortable where you are? I'm just going to put a call light here in case you need to call, okay?
Okay.
Just call me and let me know if you need something, okay?
Okay.
I'm going to call the doctor, but before that, I'll go ahead and wash my hand, okay?
Okay.
Okay.
Thank
Now,
you.
I have to call the doctor. Hi, hello, Dr. Smith. Yes, my name is Geneviève. I am one of the nursing students at Montgomery College. I'm calling you regarding Mrs. XX, a 54 years old female patient that was admitted today in our facility. Mrs. XX came in with low-grade fever for 3 days, cough with yellow sputum, and small amount of shortness of breath. She is allergic on penicillin and had a cholecystectomy surgery done a year ago. The past medical history: she has hypertension and diabetic. Her primary medical diagnosis is COPD. She is married with 1 child. She's alert and oriented times 4. And she is on low sodium and diabetic diet. She was on droplet precaution and activity as tolerated. I took her viral sign. The last set of viral sign was the blood pressure was 118/88. The respiration rate was 16 per minute, 16 beats per minute. The heart rate was 94, 16 breaths per minute. The heart rate for 94 beats per minute. The oxygen saturation is 93%. The temperature is 102 Fahrenheit. I took it a minute ago. I'm worrying about the productive cough with yellow sputum, the fever, and small amount of short of breath. Even though the oxygen level is normal for patients with COPD, which is 93%. So my concern is the fever and the low spectrum. So I'm worrying if I know she took Motrin. She told me she's taking Motrin. She's been taking Motrin for 6 days, but still the temperature is not going down. So I'm worrying about the infection. So I would like to know, like, request. I would like you to think about, I don't know if we can prescribe some lab to see if there is any infection, so the blood count to see if the white blood cell is elevated, and also if we can give her some medication for cough and for fever. But I know if maybe she's taking, we're going to do that maybe after the result for the lab, because if there's infection, we can see, we can understand why she's getting a fever. Also, if you have a chance, doctor, to come over to see her, that would be great. Thank you so much. Have a blessed day. Bye-bye.
I'm done.